What are thyroid peroxidase antibodies and their role in Hashimoto's? Imagine your immune system as a vigilant defender that protects you from harmful invaders. Sometimes, this defender gets confused and starts attacking your own body, especially your thyroid gland. This is what happens in autoimmune thyroid diseases like Hashimoto's thyroiditis. A key part of this process involves thyroid peroxidase antibodies, or TPO antibodies for short. Thyroid peroxidase is an enzyme that plays a vital role in making thyroid hormones. It helps convert iodide into iodine and attaches it to a protein called thyroglobulin. This process is essential for producing hormones like thyroxine and triiodothyronine, which regulate your metabolism, energy, and overall health. When everything works smoothly, your thyroid produces just the right amount of hormones to keep your body balanced. However, in autoimmune conditions like Hashimoto's, your immune system mistakenly sees thyroid peroxidase as a threat. It produces antibodies against it, called thyroid peroxidase antibodies. These antibodies don't directly damage the thyroid but signal that your immune system is attacking the gland. Their presence indicates an ongoing autoimmune process that can lead to inflammation and damage over time. In Hashimoto's thyroiditis, the immune system's attack causes the thyroid to become inflamed and less capable of producing hormones. This often results in hypothyroidism, where your thyroid doesn't make enough hormones. Interestingly, about 90% of people with Hashimoto's have detectable TPO antibodies, making these antibodies a very useful marker for diagnosis. Doctors often test for TPO antibodies through a simple blood test. This test is usually done alongside other thyroid function tests, like measuring levels of thyroid hormones and thyroid-stimulating hormone. Finding TPO antibodies helps confirm an autoimmune cause of thyroid problems, especially if symptoms like fatigue, weight gain, or cold intolerance are present. It's important to remember that having TPO antibodies doesn't always mean you will develop thyroid disease. Some people have these antibodies without any symptoms or thyroid dysfunction. Still, their presence can suggest a higher risk of developing hypothyroidism later on, especially if thyroid hormone levels start to decline. In summary, thyroid peroxidase antibodies are markers of the immune system mistakenly attacking the thyroid gland. They are especially important in diagnosing Hashimoto's thyroiditis and understanding the autoimmune nature of certain thyroid conditions. If you have concerns about your thyroid health or test results, always consult with a healthcare professional who can interpret these findings in the context of your overall health. Remember, each person's experience with thyroid disease can be different, and personalized medical advice is essential.